Review of the literature. Information obtained for this presentation was from the article Evaluation and Management of Women and Newborns with a Maternal Diagnosis of Chorioamnionitis, Summary of a Workshop. It was published in March 2016 and is located in the journal Obstet Gynecol. What is chorioamnionitis? If you're anything like me, you don't even know how to pronounce this word, better yet what it is. But it occurs in pregnant women, and it is the inflammation or infection of the chorion or amnion or both. The chorion and amnion make up the fetal membrane or the amniotic sac, and it surrounds the fetus to protect it. The chorion is defined as the outermost membrane surrounding an embryo, and it contributes to the formation of the placenta. The amnion is defined as the innermost membrane that encloses the embryo, and this is usually caused by infection that spreads from the cervix and vagina up to the fetal membrane. Causes. This infection is caused by bacteria entering the vagina. These specific bacteria include E. coli, group B strep, and anaerobic bacteria. The risk for developing this infection increases with each vaginal examination performed during pregnancy and even during the labor process. This is a picture that shows how the fetal membrane becomes infected. Signs and symptoms. The most important symptom is maternal fever, which is anything above 100 degrees Fahrenheit, which is considered abnormal. Some fever is normal during labor, but any fever lasting longer than an hour should be evaluated and treated. Other symptoms include maternal or fetal tachycardia, elevated maternal white blood cell count, uterine tenderness, and purulent fluid or purulent discharge from the cervical OS, which is the opening of the lower part of the cervix located between the uterus and the vagina. Possible complications include sepsis, rupture of the fetal membrane, prolonged labor, postpartum hemorrhage, adult respiratory distress syndrome, and possible maternal mortality. Diagnosis. To diagnose chorioamnionitis, blood cultures are drawn to see if bacteria is present and to determine how long antimicrobial therapy is necessary. Another way to diagnose a patient is if they're presenting with signs and symptoms or these signs and symptoms are worsening. Treatment. The treatment for this infection are antimicrobial agents which treat the mother and the fetus. But treatment should not be immediate for the mother and the baby following delivery, but they should be assessed and it should be based on the likelihood of the mother developing endometriosis and the likelihood of the baby developing a further infection. Fever should also be assessed and should be controlled with antipyretics and fluids.